Good afternoon and a warm welcome to our late afternoon talk 360 Degrees Healthcare. My name is Philipp Tholen. I'm the head of health at Zühlke. It is my pleasure to moderate this discussion with high-level experts from the healthcare industry. 82% of the population search for health information online. 71% of people under the age of 40 track their health using some sort of technology. 81% are willing to share their health data under certain circumstances. These are the results of an international study which Zühlke has conducted recently in Switzerland, Germany, the UK and Austria. Several thousand people were interviewed about their behaviors and needs with respect to digital health. The results of the study clearly show one thing: people are ready for digital health. But what do they expect from digital health? What are their needs, their concerns, their expectations? That's exactly what we're going to discuss in this panel. Get ready for some interesting insights, controversial opinions, and some recommendations for anybody who wants to develop a digital health solution. We'd like to invite you all to contribute your thoughts to the conversation and make it a lively experience. We will be using the tool called Slido for that. If you would like to ask a question, please scan the QR code with your smartphone and fill in the form you will see thereafter. If scanning the code doesn't work, you can also go to slido.com and enter the code manually. At the end of the discussion, we will have a Q&A session where we will discuss the most popular questions from you, the audience. Please forgive us though if we won't have the time to answer all questions that are entered. Before I'm introducing our valued guest speakers to you, I'd like to ask you, the audience, about digital health. Please use the QR code to answer the following questions. What are the main improvements which you personally expect from digital health? Now, while the answers keep coming in, I'd like to introduce our guests. First, it is my great pleasure to welcome Kiva Valerie Gilroy to our panel of speakers. Kiva is one of the people who have done it all and seen it all. She's currently busy doing her PhD in the area of clinical trials and methodology at UCL in London. Furthermore, she spent more than 18 years in management positions in the pharma industry. Amongst other positions there, she was global head of digital health and therapeutics at Merck. Recently, she's joined the startup world, being strategy director at the digital health accelerator called Day One in Basel. Our next speaker is Stephanie Loy. Welcome.
Thank you.
Stephanie has a master's in statistics. She spent around 20 years in the insurance industry. Particularly, her current role is of very high relevance for us. She's the CEO of LiveWell, which is a subsidiary of Zurich Insurance. As such, LiveWell supports individuals to take ownership of their own health and well-being and provides support on the path to a better self. Therefore, Stephanie represents the insurances, the payers of digital health solutions, as well as the individuals, the consumers of digital health. Last but not least, it is my pleasure to welcome Professor Natasha Phillips to our panel.
Thank you.
She's an honorary professor at the School of Health and Society in Manchester. Besides that, she spent around 30 years in the space of nursing and nursing informatics. And she was Chief Nursing Information Officer in England until earlier this year, when she decided to start an organization called Future Nurse. Future Nurse empowers nurses and midwives in digital transformation and technology in general. So you see, we have different stakeholder groups represented in our panel. That's really a 360-degree view on healthcare, I think. On one hand, we have Kiva, our first speaker, who represents the pharma industry as well as the digital health startup ecosystem. Then Stephanie, who represents the payers as well as the patients. And the HCPs, on the other hand, are represented by Natasha. Now, you ready?
Let's do it. Let's go.
Let's jump into the discussion by looking at the results of our first Slido survey. Again, the question was about the improvements you expect from digital health solutions. So we see there's two things popping up here: lower costs and data-driven decisions. I'd like to ask you first, Natasha, what do you think? Are these expectations realistic? Are they unrealistic, wishful thinking? What is your assessment on that?
Okay, thank you very much, Philip. I think the data-driven decisions is an interesting one and is absolutely a fair expectation and a realistic expectation, but we probably have some way to go to get to that point in terms of having data that supports the full continuum of care. So as a nurse and a healthcare professional, you know, nurses have the most interactions with patients, spend the most time moving data around. About 25% of our time is spent acquiring and retrieving data to share with others. That's got to be improved by digital, and that will help us be more in relationship with our patients, but obviously support patients as well. I think the lower cost one is interesting. I'm no economist, so probably the least qualified to answer this question, but I think we do often claim that things are going to cost less, but I think we should focus more on different rather than less cost. So how will patients and citizens have a much better experience? I think we can make the assumption that if we use good data, good information, and focus relentlessly on healthy people and healthy populations, the assumption that somehow the expenditure on healthcare should drop. It should certainly move from the secondary care sector, the hospital-based care, much more out into the healthy spaces. But we have yet to see that, I guess.
Thank you so much. We'll talk about data-driven decisions later in the conversation, but lower costs, I have to ask you, Stephanie, insurance representative.
Yeah, I think the more accurate information that everyone has in the ecosystem, the better equipped we are to get people to the right treatment at the right time and really try to shrink down some of those, just the length of time it takes for folks to get treated and cared and back to work. I'm a huge, oh, I shouldn't touch that. I'm a huge proponent of what Natasha just said, which is I see the dynamics of the money spent really shifting from the treatment side of the equation to the prevention side of the equation. Because as we get more informed by data and more precise with how medicine is applied to an individual case, the more it really flips its head, and we're really focused then on preventing it from the beginning.
Thank you so much. Kiva, what are your thoughts? Patient care improvement, any thoughts on that, or other keywords that popped in and that have been quoted?
For me, what I find really interesting in this is the assumption that efficiency is going to happen. There's a requirement that that's going to improve efficiency, or there's going to be more efficiency. I think that digital health is a tool to improve that, but it's not going to fix it. So I don't think, if we mitigate, what people's expectations are on this and manage what we can do with digital health, I think we look at how we can leverage digital health, digital technologies to improve efficiency over the entire ecosystem of what health looks like. And I think that's where digital health will have a massive impact, not just at the patient level, but at the policy level, and also at the institution level, where we get the vast majority of our care.
Thank you so much for those contributions. Let's move on to our next slide. I'd like to talk about trust in digital health. Kiva, I'd like to understand from you if you think that digital health has a trust issue. I mean, we see on the slide that that's maybe not so surprising. Users are more open to use websites of doctors and hospitals to research information than they use digital health apps like Ada or Babel. That's maybe not so surprising, but still, DGANs in Germany have a hard time penetrating the market. Apparently, doctors seem too reluctant to prescribe DGAs. We seem to have a low willingness to pay. Our research shows that an average user only is willing to pay 10 francs or less for a digital health solution compared to Netflix subscriptions, which I guess are much more expensive. So why is there not more traction? Why don't they trust in those services and subscribe to those?
I mean, that's a very complex question, and I think there's lots of different ways to look at it. But I think from one of the things that I'd like to put forward is, first of all, yes, we do have a trust issue with digital health, and it is not surprising. And the reason it's not surprising is because we are actually trained as a society that we go to the doctor. The doctor is the one that gives us the information on our health, or the healthcare provider that will provide us the information on our health and how we change things and how we improve things. I think by the launch of the digital health apps, there becomes a big blur between a consumer app and a health app. And I think what we need is much more structure and rigidity around, and I know rigidity is not a great word to use about this one, but let's be honest, we do need to have much more structure around a health app that is actually going to have an interventional action for our health. And the reason why I think we have the biggest issue with trust is that people, yes, you're right, will pay 17 euros a month for Netflix, but therefore that's what they're used to. That's their baseline cost. So if you're looking at asking for more than that, then the justification is, how is that trustworthy in comparison to the information that I get from my healthcare provider and my doctor. So I think one of the things that we really need to do is not necessarily focus immediately on the end user, because the end user will use what is recommended to them that they trust and from people that they trust. And it's about how do we actually transition the healthcare providers to have faith and trust in these solutions to drive that adoption within the general public.
Thank you. Stephanie, I'm wondering what's your take on that? I mean, Liveless is really close to the patient, to the individual. How do you see that? Do they trust? Do they not trust? Why yes, why no?
I mean, I think your results are clearly what we see, and a lot of work at LiveWell goes into, and at Zühlke as a whole, goes into that data, like commitment and that transparency to build up the trust. So from us, and maybe a little bit about LiveWell and where we're positioned, we see ourselves as the toothbrush, not the dentist, right? We want people to engage with us every single day before they need, that next treatment, that next step in the care. And for us, that's really important that it's slightly lower stakes. And so we have to earn our way. So we're starting there and we want to build up that trust, but you build it through the transparency. Where's my data? Where's the expertise? So partnering with better experts in this space. So we're doing work now with the Zühlke Foundation and UNICEF, because that is a subject matter expert in this space of youth mental well-being. So as we're approaching that space, how do we partner with the best in class there and really lean into their credibility to then, again, transfer that and start to do the hard work of building the trust up?
Thank you. Thank you very much. Now, we've spoken about trust and users in general. Now, let's look at the subsegment of the whole population, which is the one on the left-hand side, the younger, I still count ourselves younger, below 39 years old. So they are very open to use online search for health symptoms. I think that's not so surprising. The younger people are more digitally savvy, that's clear. But apparently, they are the ones who go to the doctors most often. That's surprising. We've seen that in the study that Zühlke has done in those 4 countries, and apparently they go more often to the doctors, and they have a very high willingness to pay. Now, the question that relates to is there seems to be a really attractive segment which should be the target segment for digital health, and have we leveraged that potentially at Stephanie? What would you say?
Yeah, so that is one of our target segments, absolutely, because clearly the data shows there's the interest, the intent, the desire is there, so the need is there, and then the willingness to pay is always that kind of the other side of that equation that makes it an attractive segment. I have to say, when I saw the results, I was quite surprised. It's such a high number visiting a doctor once a month, which I'm sure puts a lot of additional burden on our healthcare professionals. So I think the more we can do in partnering them up with other means to help alleviate some of that will be really important. But I think, if I think of that generation, the younger generations as a whole, I mean, health is the new wealth, right? So we're more about experiences, we're less about material things. So if you want to, live your best life and really enjoy it as best you can, you need to be focusing on, well, how am I? Am I healthy? What's my well-being? What can I do from a prevention before I get to a point where it's now, limiting what I can do and how I can enjoy my day-to-day. So I think for us, that's a very attractive segment, and we're seeing similar user demographics on LiveWell today.
Very good. So at least there's an overlap between what you research and what we do. That's
exactly
good validation. Natasha, how do you see that? From your experience, what does it take to convince a patient or a person to trust the digital health solution and use it and pay money for it, actually?
Well, I think it's been a really interesting conversation on this point so far, and colleagues on the panel have made some great points. And I was really heartened to hear Quiva talk about the fact that actually you need to get healthcare professionals to be confident and trust apps if you want to win patients over. Because ultimately, yes, we come from a sort of patriarchal society where people think doctor knows best. It is what it is. We've got to work with it. And sometimes doctor does know best. So how do we bring that medical, nursing, healthcare professional expertise into the development of the digital ecosystem to make sure that it does so much more? Because it frankly, as a healthcare professional, scares me when I see what's really interesting about this data set for this younger group, which I'm not in. I'm in the next column along. No, in fact, the next column along. How heartbreaking is that?
We don't disclose.
But what really is worrying is, are we creating an anxious society with apps? So the more they monitor, is that what's driving them to the doctor? So do we take the apps to the next evolution, which enable people to self-care so that they can take intervention? And taking your toothbrush analogy, they move beyond the toothbrush perhaps to flossing or the next stage in their care before they reach out to the healthcare professional. We, of course, want to make people, citizens, much more responsible for their own care. It starts with really great education. That requires using the expertise of healthcare professionals in the build and design of applications, as well as the voice of those consumers, to get to that point where the applications do so much more than just monitor a whole load of numbers and data.
You said it, anxious society. Quiva, I'd like to hear your take on that. I mean, if it comes to using all kinds of websites, search engines, social networks, we seem to be everything else but an anxious society. We share our data left, right, and center. We accept cookies everywhere. And when we speak about health, digital health, all of a sudden we seem to be anxious. How can you explain that?
I mean, we love Dr. Google. Let's be honest, we all love Dr. Google. And to the point in the panel so far, I would look at it very slightly differently, being one of the two columns on that one, in that I would say, should we not look at it? Yes, there is quite a high level of people visiting doctors, but should we look at that as, it's not a burden, it may be a burden right now, but how does that reduce the burden long term? So are we looking at worried well, or are we looking at early adopters of preventative health? And so for me, I personally would be saying, let's actually look at that as a good thing. Look at these people as the forefront of preventative health. And that is how we then reduce the burden long term. We just reduce the cost, we improve health within the society, and we improve people's enjoyment of life at the end of the day. So for me, I just wanted to make that point. But if we're talking about data and why we worry about sharing of our health data, I mean, I think we really need to understand and acknowledge the fact that health data is fundamentally much more intimate data than it is just our preferences of whether we like Netflix versus Amazon Prime Video, or whether we like Migros versus Co-op as a supermarket. These are fundamentally much
personal.
It is a very personal, and sometimes don't even get it into the Aldi versus Lidl argument, because that goes down a whole other route. So I think we really need to acknowledge the fact that that's data that people worry about, because what will that have an effect on, and do they stand to lose by that? And I think to shift to our conversation earlier on, how we use data, health data, for the greater good, it's not so much about the sharing of the data, though the cybersecurity and the data privacy does have a massive input in that, but it's what it's going to be used for. Yeah. So as soon as you let your data go, you can no longer control it. And we can't guarantee, and people are not guaranteed, that that is going to be used for good. And what happens to that person if that data is not used for good, and how will that have a detrimental effect on their life, on the care that they receive, on what they're accepted for within the community? That is where I think that we need to work a lot harder on making sure that people understand what it's going to be used for, and working incredibly hard to make sure it's protected. Yeah.
But still, I'm challenging you on that a little bit, because if you talk social networks and search engines, do we know what the data is going to be used for? I would claim we don't, except for the commercial success of the respective providers. So why is there this discrepancy? You were nodding, Stephanie. Maybe you have thoughts on that too.
Well, it's a bit off topic, but for me, I think a lot of us grew up in a day and age where giving that data, we didn't even understand the concept. We didn't understand what we were giving up. And now it's so ingrained in us that we've been desensitized to the things that were already there and had kind of been part of our daily routine. But now we're hypercritical and sensitive to kind of outside of that ecosystem. And again, I agree with Quiva, like sharing your personal health data is very personal. It's very intimate. What does that mean? And if given to the wrong hands, what could happen? And so maybe just really quickly, one thing we're really focused on is almost this data vault concept where users are in control of their data. They understand what are they giving, and in return, what's the value they're getting back, and they can toggle it on and off. It's up to them, and at any point in time, if that value equation no longer works for them, they can turn it off, and really empowering them so they're in control of what they do and who they share it with.
All right.
Can I interject?
Absolutely.
Thank you so much. Absolutely agree. I'm convinced by stories more than data sometimes. Perhaps that's part of who I am and my profession. But I think you're absolutely right about the control thing. But we need to get those stories out to say, well, what is the benefit? So we need to hear from people about what the benefits are in order for people to feel safe and trusted. And they need to see people like them represented back to them saying what they got that was a benefit. So that's probably a gross oversimplification. But I think actually, there are huge benefits to be had by sharing our health data.
Absolutely.
And mostly people get quite frustrated about the amount of times they have to share it as a healthcare professional. It's like, I told so-and-so, I told so-and-so. So when it's
Do you guys not
lowest...
talk?
But they assume we do, and then know why you don't know about them. How strange. But so at its lowest level, you know, we need to get that right. But at the macro level and the opting in and out to use your data, you know, for big population health stuff and having an impact on other people's care, I think we can convince people of that, but we need to do it through the data, but we also need to do it through stories. And that's not to underestimate the huge and not insignificant challenges around cyber and all the other things. But we get so caught in that we sometimes lose sight of the prize.
Yeah. So what I hear you say, it's not about like GDPR regulations, systems and technology. It's about communication. It's a marketing job, basically.
And it starts with healthcare professionals, Philip.
Yeah.
So healthcare. We did a review of the preparation of nurses and midwives for the digital age in the UK, and what we learned was they don't understand any of this stuff. And if they don't understand it, they can't advocate for patients, which is a core part of their role. So I think one of the fundamentals is to make sure that group, the whole healthcare professional community, is upskilled and confident and able to inform the debate in order to ultimately sit in front of a patient and say, it's okay to share your data in this way because what it's actually going to do is this.
Perfect. Thank you so much. I think we could carry on with this conversation for very long, but we have so much more to do. So let's move on to the next topic, which is solidarity in data. Related but different. I mean, currently in the insurance space, we have financial solidarity. As a healthy person, I contribute my money for the people who are not healthy, who need it. So the question goes to you, Stephanie. Could you envision a world or an ecosystem where we have solidarity in data as well, where as a healthy person, I contribute my data, my health data from whatever blood tests that have been done, studies I've participated for the greater good, so that the data can be used to develop new products or better products to help those in need? Could you envision that?
I can envision it, and I do think there's something quite powerful. I truly, in my core, believe in precision medicine, because you can learn so much about, you know, what would it be for Natasha to be healthier in this moment, and what would it look like for me? And those can often be very different things, and that you only learn that by pooling the data and starting to really uncover patterns. And it can be truly, truly powerful, but I think we're a long way from it because, again, we get back to the trust factor, we get back to systems and pipes need to be connected so that the data flows to where it needs to flow. We need to be able to articulate the value of it and not be fearful of, you know, I equate it almost to telematics in the auto insurance space, right? Oh, you can now monitor how well I am as a driver, and I'm scared my rates are going to go up because you see something, right? And so even though that's kind of how it's always been, because if you get a ticket, you have an accident, that's how it works, it just feels more intimate and more, it's just a harder equation to get comfortable with. So I'd love to see it happen, and I think we're seeing, I mean, post-COVID, there's a higher adoption of sharing of data and using digital means. So I think we're moving in the direction, but I think we're a ways away.
Thank you. Kiva, I know you have a strong opinion on that. Share it, please.
So I'm with Stephanie on that. Do I, in a utopian world, think that is the thing that we should be doing? 100%. I think it definitely comes down to the two things that were previously mentioned in the last point, which is what is the data going to be used for? So how do you know that that's going to be used for good and not potentially for developing something that is maybe not necessarily as valuable to humanity? So there's that. And also, how do you ensure that there's value to the person? You know, you're giving away what pharma companies and other companies pay an absolute fortune for. If you get a well-characterized data set, it's worth a fortune. So you're giving away something, and what are you receiving in return? I would almost, for me, it's very similar to a clinical trial. So a clinical trial is kind of like how this would work if it really worked. So people go into a clinical trial for two reasons. They go because they really hope that the treatment is going to help them, so they're getting something out of it. But they also go because they are happy to contribute their data, because it's maybe potentially going to help someone long term. And you mentioned about how do we, you know, leverage data for being able to develop new treatments. And so basically what we have to do is scale the trust in a clinical trial to the sharing of our health data more broadly.
That's really interesting. And I guess what's different is the specificity.
Correct.
So people do that in a specific situation, and clinicians sign you up to clinical trials where they explain all this, and you make an informed decision as a person. And the challenge, of course, is to just generically release your data or do it at scale is where the challenge really sits. And I'd never thought of it before, but what you triggered for me there was I thought, how many times probably I myself and other patients have gone in front of their doctor and said, oh, I only drink 3 units of alcohol a week. So actually the fear of being seen for your real behaviours and owning up to yourself your real health behaviours is a massive, massive challenge.
Yeah.
Thank you so much.
Some social science needed here.
Yeah.
Thanks for those contributions. Let's involve the audience out there. We have a next poll coming up. We'd like to ask you who you would donate your health data to. So if you were to donate, let's assume you're willing to donate, who would you do that to? Please use the QR code provided and answer your question there. We will move on in the meantime and come back to that slide later. So I'd like to shift the focus a bit. We've been talking about the patient, the users. Now, what about the HCPs? And you represent the HCPs, Natasha. What do you think? How far are they along their trust journey, if there's such a thing like a trust journey? Do they trust digital health? Are they willing to work with digital health? What does it take to convince them? Because it's at the end of the day, it's them recommending a product to a patient, right?
So I guess like any population, it's not generic, is it? So what I notice is that very early career healthcare professionals are really keen to, they experience the rest of the world in a very digital way. Okay. They walk into healthcare and find it quite frustrating often that it's not as digital as they might have expected, and so they're hungry for it. And then a large portion of our leaders are probably not digital natives. So it's more challenging for them to embrace digital care on top of already what are very busy agendas and think, how am I going to carve out time to learn and understand this enough to lead the wider workforce? So there's real variation, I think, in terms of how ready healthcare professionals are. But what we learned through reviews like the Topol review in the UK and the Phillips Ives review is that education is far behind, healthcare education is far behind practice. So people are being educated for an analogue world. So really we have to start with our future workforce now, whilst also trying to influence the current workforce to prepare them so that they are ready to consider these complex issues in order to really embrace digital technologies so that their consultations with the patients in the future are introducing them to technology that's going to enable them to self-care. And I guess that requires a paradigm shift would be my last point, because what we really need to do is seed power. And we're in a very powerful position as healthcare professionals. You know, people are very vulnerable with us. So it will require a shift in our thinking about seeding power to people, citizens, patients.
Thank you. So seems like Natasha has written off the senior HCPs already. Kiva, what's your thought?
I mean, I actually don't disagree with anything Natasha has said, but I also think that those of us who are developing the solutions, the digital solutions, do have a responsibility to integrate the use of those solutions into what a workflow would look like.
Yes.
So I speak to quite a large number of NHS practitioners in Northern Ireland. And they busy say to me, that's lovely, but that's not helping when it takes the letter. You know, we refer a patient to a specialist, but it's a letter that takes 6 weeks. And then when you get the letter, then you have to phone and make an appointment, which takes another 8 weeks to get, blah, blah, blah. So they're saying, so anything you develop may be cutting edge, may be incredible, but it doesn't actually fit into our workflow. So first of all, the solutions, the digital solutions need to be fit for purpose, and they need to take into consideration how the users are going to leverage them within the entire ecosystem. So to Natasha's point, yes, we need to start with education. Yes, we need to overhaul the whole system everywhere. But we're not going to be able to do that. So how do we make those incremental changes that are always going to be positive without having this idea of we'll throw something in and if it doesn't succeed immediately, we'll kill it and we'll never come back to it, you know, things like that. So for me, I think that those of us who develop these solutions really have to know how that's going to not just add value, but how it's going to integrate into clinical pathways of care.
Yeah.
But are we then too ambitious? Are we trying to go for the revolution instead of the evolution? Should we try to take smaller steps? What do you think?
I mean, what do they say? Shoot for the moon and land amongst the stars. I don't think we should stop trying to stage the revolution. I really don't. I fully believe in the healthcare revolution. I'm just pragmatic in that how we get to the revolution is minor, small changes along the way. I mean, one of my favourite things is that the 2008 Beijing Olympic cycling team, in the British cycling team, said that every tiny incremental change added up to that massive year that they had where they won all the gold medals. So it's about how do we look to the end goal, but not try and take that one massive jump to the end goal, but look at all the small minor steps that accumulate to that end goal.
Perfect. Thank you so much. Now, we have representatives from the UK. I'm personally from Switzerland. I was wondering, are there regional differences in behaviors of HCPs, behaviors of patients, of individuals? Is the thinking of the people the same everywhere? And I think you, Stephanie, with LiveWell, you've done a lot of research on that. Can you share some insights from your own research team?
Yeah, so LiveWell's in like 27 different countries and 10 different languages. So we've had to really try to wrap our hands around the differences in the different geographies. And so one of our recent surveys that we did found that the adoption, the willingness to use, wearables, trackers is vastly different between, let's say, APAC and Latin America on one side, and then Europe and the US on the other side. So that's what you'll see on the slide there, a noticeable difference there. And for us, what that means is we're going to focus on some of our early groundwork in the cultures and the environments in which there's already a propensity to want these types of solutions to really figure out the best fit. And then we'll take that then to kind of the maybe less along their journey adoption countries.
Kiva, how do you see that? You worked in international corporates too. Any data you picked up there as well?
So from my perspective, it's almost like the one thing that is really important is it's not copy and paste. That's the big challenge. So you have those early adopters who are already biased towards wanting to use and leverage solutions and move forward with that. And they are going to take off and it's going to be brilliant. And the big challenge that we have is, again, managing expectations, is because you won't be able to take a cookie cutter of that and then plug it into a geography that is less inclined to the digital. So it's about how how do you build something that is fit for purpose for that region because it differs? So for me, it's more about how do you build that underlying foundational framework that you can build on modular requirements for each individual country and geography, because not only are there going to be challenges with people's cultural adoption of things, but there are going to be regulatory challenges, there are going to be government challenges and policy. So
and different players in the ecosystem that you have to work with.
So that would be my thing for people who find immediate success in those really switched on geographies. That's great, but remember, you're not going to have that success immediately in other geographies, but that's okay. That's not a failure. That's a how do you then adapt your product to be really fit for the people who are using it.
All right, so that sounds, again, it's more complex than many think, and you work with startups a lot, and I also worked in startup before, and we were thinking we can conquer the world in one step, but it sounds like we need to...
Usually two.
We need to manage our expectations, I think. Very good. Okay, so I'd like to move on to the next point, the continuum of care. So sometimes the industry talks about the so-called continuum of care, which of course is a theoretical concept where you have the circle of health on the left-hand side. So normally we want to stay in that circle of health, being healthy citizens. But whenever we have first symptoms, we get admitted to the circle of treatment, which consists, again, simplified of diagnosis, treatment, monitoring, and hopefully we get back to the circle of health as soon as we can and stay there for as long as we can. Obviously, this circle of treatment is much more complex than displayed here. And obviously, those two worlds cannot really be separated. They somehow need to be together. And the goal is like a seamlessly integrated circle of care where all players involved work really well together. So ideally, that's all digitized because that's what technology companies are here for. But what do you think? What is your impression? How close are we to this vision of this fully integrated, fully synchronized, fully digitized circle of care?
I just heard 6 weeks for a paper mailing. That
says it all.
That's a good day. It's when the post's working.
You have an opinion on that, Kiva?
So my opinion is that you can't separate that, and I'm not a big fan of these two circles. I'm a big fan of continuum of care, but I'm also a big fan of just continuum of life, because that's your life represented in that one. For me, the siloing your treatment away from your overall health system is probably it's quite problematic, and it's going to, first of all, it ignores chronic conditions. It ignores people who are interested in preventative health. So you may have treatments that are happening that are pre-symptomatic, which means you're not going to end up with a condition, but it's still technically a treatment, but you're still healthy. So it's about how do you build that into just your overall life cycle of this is what we're going to do, because at the end of the day, you never go back to baseline. You never go back to baseline. And I think we had a conversation yesterday where somebody said that from the day you're born, you start to die. So having that circle...
Very optimistic.
I'm pragmatic. I'm pragmatic. It's about how you keep that dying thing as far away as possible, and your basically your level as even as possible, so you don't have these massive dips and troughs of health. And so for me, I think that is where we need to start focusing. And are we there yet? Oh, no, we're not. But there are so many people out there that believe in this, and there are so many people working towards it, that I have massive faith that we will get there. Just let's see how long it takes us to do so.
Thank you.
Can I just interject? One thing that I think is not represented here on this slide is also the different dimensions of well-being and health, right? Because, you just said something that was very depressing, so now I need to go work on my mental well-being after this, right? But we've got the physical, we've got the mental, we've got the social, and we've got the financial. From a Live Well perspective, those are the 4 dimensions that we're focused on. And I think what you see a lot of players on the left-hand side of this slide are very, very focused on a very specific dimension. And I think that fails users in a lot of ways, because health and well-being is very complex. And there's so much, if I don't sleep well, how does that impact my, even my finances or my ability to get my work done, or, if I'm gonna get sick. Just everything is so connected that I think one of our main jobs in this space is, working on digital health, is to help users understand and make sense of the vast amounts of data and the noise, and show how things are connected, but give it to them in a very actionable insight way. Something that makes sense of the noise and gives them a clear action. And so I think that holistic approach needs to be, we'll talk to your slides, guys.
Natasha, something
I
on the
think we should talk about the continuum of health, perhaps, rather than the continuum of care, i.e. health isn't one thing and health is different things to different people. So in whatever your fullest sense of health is, you will be interacting with health care. So I think that's really important. And I guess my plea would be, okay, let's hurry up and do this tech stuff really fast to help with that, because in my profession, basically we are the joiner-uppers of care across this continuum that you describe. So you will see nurses who are doing a lot of translating of information to people and forming that continuum across different care settings. In fact, they're spending about 15% of their time documenting stuff to facilitate that continuum, and then 10% of their time sharing information to facilitate that continuum. They then spend about 25% of their time on meds admin, much of which is ripe for automation. We are desperate to be able to spend more time in relationship with people, helping them be healthy. So we really need technology to serve us. And currently, technology isn't serving healthcare professionals very well, and therefore it's not serving people very well.
And to add to that, I think, to your point about healthcare or health looking different from everyone, we can't dictate what a one vision of health looks like. So that's where it becomes difficult in the circle of health. I think what we need to look at is, how do we empower patients to make decisions that are based on their lifestyle choices, that how they want to live their lives, what health looks like to them, and how do we action that through technology that provides them the data, that provides their healthcare providers with the data to help advise them. And that is where you'll end up with a more holistic view of health.
Caoimhe, you should join the nursing profession. Essentially.
Okay, job interviews after the session here, please.
30 years ago, we were talking about this. In nursing school, this is the job. We're talking about as if this is new work. It's not new work. It's the job of healthcare. What we need to do is get the tech to help us do our job better.
So that's something I picked up from you, and I represent the tech industry. Obviously, it hurt me to hear that. But still, in order to have technological solutions that work, that really serve their purpose, I guess there's a lot of stakeholders who need to collaborate nicely. The insurers, the HCPs, the pharmas, and the medtech companies, they need to work together. I think it only works in collaboration. Yeah. So one sentence about your assessment. How well do they collaborate nowadays? I'm keen what you guys have to say. Maybe start with Kiva.
Not well. It's probably. I feel like I'm the real pessimist on this one. I'm not. I feel that it's important we point out problems so that we can fix them, and that's for me is very important. So I sound extreme and say no, everything's rubbish and it's not working. But what I'm saying is people have good ideas, and on a surface level they say we're doing things and they say we're making these things, and that actually doesn't help us. Because that's not actually digging down and dealing with the underlying challenges that if we fix at the foundational level, that we will actually be making these changes. So, we talk a lot about user-centered design, and user-centered design within the pharma industry might not be the same as what user-centered design within the healthcare institutions mean, or what the insurer's policy is. So unless we have actually a dictionary where we actually agree on all of the terms and everybody goes, okay, yes, we understand. And having worked, and that's even difficult within the pharma industry. So I've worked in four different pharma companies, and each pharma loves an acronym. And I'm fluent in 4 different acronym languages, because they may be the same letters, but they mean something completely different in each individual company. So how do we expect to actually achieve if we don't have that initial setup where we're all on the same page? So for me, first of all, that would be a big step forward. I think there is a huge amount of value in that collaboration, because it's not competition. We're not competing for health. We need to scrap that completely. It's collaboration, not competition. And you know, what's the saying? If you want to go fast, go alone, but if you want to go far, go together. I think we're at a real inflection point where it's time health goes together.
All right, thanks. So from your point of view, insurance point of view, how's the collaboration in the ecosystem?
I'll be the more optimistic, I guess. No, I think it's improving, right? And I think, you know, there's a saying where focus goes, energy flows. And I think coming out of COVID and what everybody, you know, as a global population, what we experienced, all of a sudden there's now more interest. We've shown, you know, that digital health can be done, and we've started to pave the way forward, and we're having conversations that weren't being had before, and there's now an increasing willingness, right, from the end users. And so when that customer expectation and demand comes, again, that's where the energy starts to flow. So I would say the trends are encouraging, and I see a lot more entrants paying attention. And obviously your role is one that's playing translator to help the worlds work together. I play a bit of a translator role as well, from insurance to tech and startup, and trying to fit the pieces together. So I'm optimistic.
Perfect, thank you so much. Now, earlier today we asked the audience about who they would donate their health data to. Let's look at the results. There's a big majority voting for research institutions. I guess that's not surprising. Healthcare providers come second. What do you think? Is that surprising? Is that something that you would expect it?
I'm very surprised by the low proportion of people talking about healthcare providers. I could make some assumptions. They are just data points. So perhaps people already assume they're giving that anyway. I think what people really are passionate about is improving, and they know that research is a pathway to that, and that might be why we see 65%. I'm probably not too surprised to see the very low percentage with pharma companies, health insurance, tech companies. Again, I think we've talked about trust here in this room and separately over the last couple of days. There is a sort of trust issue to be dealt with there, to make people feel confident in that, in sharing with those organisations, really, and that probably has to be one on a not a case by case basis, but a sector by sector basis, perhaps. And I think there's a lot of assumptions about how our data is used that's underpinning this.
Thank you.
Good for people that want to be involved in studies, though, isn't it?
I'd like to have your opinion, critically, Kiva, on that one. Pharmaceutical companies score low. You might have a very strong opinion on that, since you spent a lot of years in there. It might be a career-limiting move for you to say something now, but let's give it a try.
No, I'm not surprised by this. And I think, you know, there was a study released last week where it was an overview of trust in companies in the US, and the pharma company succeeded in managing to come last. So it is the least trustworthy industry in the US as polled amongst the US citizens who wanted to answer the question, obviously. So it comes below the federal government in the US, which, as a European, I find hilarious. But that's what it is. So, of course, we're looking at an we're looking at an organisation or an industry that doesn't have an amazing public relations understanding. So I would say, you know, the 5% that are interested in donating and happy to donate, they're probably people who are involved in the understanding of clinical trials and how treatments are developed. And there are a lot of, and this is the really important point that I want to make, there are a huge amount of people within the pharma industry in general who have that altruistic mindset, who are there to make a difference and who want to further humanity. The problem that they have is that they are inside something that is perceived as a business. And at the end of the day, when people look at it, they go, that has to make money. And it does have to make money. You know, there's a lot of complaints about the cost of new and innovative treatment. But sitting, you know, on average, it's over $2 billion to develop a drug. It takes 12 years and $2.3 billion, I think it is, to develop a drug. For us to continuously develop those new drugs, we have to make money on them. So I can understand why people will look at it and say, well, you know, you're just trying to make money off us. But at the end of the day, the people within the industry are actually doing their very best to bring the next generation of treatments forward.
Thank you. So to slowly come to an end of the interesting conversation we're having today, I'd like the three of you to come up with a short statement about what's the vision of the organization you represent of digital health? How do you see digital health? What's the vision? How far are you along that journey, and what are the main obstacles? Just like 2-3 sentences each. Maybe you want to go first, Stephanie?
Sure, happy to. So at LiveWell, we're really trying to make health a habit, right? So we're focused on the prevention side of the equation, and we're really trying to, again, engage our users on how to help them on their health journey. So what is their health goal? What are their current fitness levels? How do we make sense of the noise and curate the right experience, and then connect them to the right services based on their very personal needs? And I would say, still early days, but in terms of user feedback, engagement numbers, visits to the app per day, we're making some really great progress, and we're excited.
That's good to hear. The optimistic view of things. Natasha, what is your take?
So I'm going to start by going back to the question that you asked a couple of questions ago about how well are we working as an ecosystem. And actually, I have a more positive view as well. I think in pockets we do this really, really well. My experience is really positive of this. So when I think about the pandemic and bringing in the NHS app, we got over 30 million users in the UK of our NHS app now. So
which was done by Zühlke, by the way.
Really?
Yeah.
And necessity is the mother of invention, isn't it? So go with the willing and work on specific problems, specific healthcare problems as an ecosystem, and you'll get further. And I guess that's part of the mission of Future Nurse, is really to say, actually, we have been really poorly served by tech as a community. We're very rarely invited to the table, even when suppliers and innovators are speaking to the health community. It's very rarely this group who actually represent a third of the workforce and have most interactions with patients and most interactions with the tech. And actually working at the interface of admin and care delivery are really useful for implementation and adoption. So I guess for me, the point of setting up Future Nurse was to say, let's start getting our voice into that space. Future Nurse is about partnering with innovators, suppliers, other entrepreneurs, and bringing the entrepreneurialism of my profession to the discussion so that we work as a diverse community, bringing our expertise into solutions. And I think that will yield results for those that wish to develop tech.
Perfect, thank you. We're running out of time slowly, so maybe, Quiva, your very short assessment of the situation.
So you want me to round up with a negative? Is that what my...
We'll have questions afterwards. Maybe there's some we can answer.
Yeah, exactly. So I work for Day One, and Day One within the Basel area, innovation and entrepreneurship are massive believers in the value that digital health startups bring to the ecosystem. So for us, we want to accelerate those startups. We want to bring them to the potential clients and customers that they can actually interact with and scale the solutions that we have. And so for us, the biggest challenge is how do we make sure we set those startups up for success? Because what, pharma has as the biggest disease within pharma is pilotitis. So how do we prevent those startups going in to start something, and then because they're not set up for success, they're not able to scale it across after the pilot? So for us, that's something that we work really, really hard on, and making sure that those startups are ready for exactly the challenges that they're going to face with their clients.
Perfect. Thank you so much. Thanks for these interesting thoughts. So, we're almost at the end. We want to spend some time on Q&A. Let's look at the questions we received. There's some question from Nino, who says, not everyone has equal access to digital health solutions, primarily due to socioeconomic disparities. How can we overcome this hindrance? Not an easy one.
I think we all have to be very, very aware of not creating that digital divide. So we know that socioeconomic issues actually impact health, and to Stephanie's point about that entire ecosystem of what health is, as providers, we need to understand what area we can work in within the regions. Back to that point on making sure that we provide the basic amount of support that anybody can access. And so we also have to look at the idea of that It's about how do we empower the healthcare system as well through digital health solutions. So no, maybe not everybody will have the latest iPhone that can download an app or have X number of wearables. But if we are building solutions that actually can elevate the high-touch model of healthcare systems for patients, then at least we're moving that needle closer to everybody being able to benefit from some form of digital health solution. But it's not easy.
How about flipping it? So actually, how can digital health solutions be the problem to the already existing health socioeconomic divide with healthcare?
Democratize healthcare.
Yeah. So how do we do that? And the only way we'll get to that answer is the first step is data. We come back to data, understanding those populations, and then engaging those populations. And I think there's always got to be a fallback that digital won't be the solution for everyone. And so that's our responsibility as healthcare professionals to make sure we've got an alternative model of care where we need to have it.
Perfect, thank you. Let's go to the next question from Peter. How can healthcare professionals benefit from digital health tools and solutions? I guess that's the one for you.
I was going to say it was meant for Natasha.
I think I've banged on about this enough.
Were you under the table?
It's not staged.
So, it's about releasing time to care, isn't it? That's the main way we benefit, because we all enjoy being in relationship with our patients and not doing tasks that don't feel like they're adding value, tasks that are making more work for us. So that's where we need to get to. How we'll benefit from that is by engaging in the development and design of digital health solutions. And if you're not being invited to the table to do it, I think is just stick those elbows out and push yourself into the conversation to make sure that our voice is there, because I think it's our responsibility to do so.
Thank you, perfect. Dear guests, time's up already. So we've had a very inspiring and thought-provoking conversation. I think you saw that we could carry on forever, but we need to stick to the Swiss schedule, right? So we looked at digital health from different angles. I think we all agree that a lot remains to be done to eventually achieve a human-centric, seamless and cost-efficient healthcare system. First successes are there, but we need to keep on innovating if we want to reach our goals. With the rise of new technologies such as generative AI, digital twin and the like, we get new opportunities to do so. But at the same time, the challenges like data protection remain, and regulatory hurdles, they're also not getting lowered either. However, I think it is fair to say that we all here in the studio remain optimistic and focus on the patient, and that we see a bright future for digital healthcare. And of course, we hope you do so too. Dear speakers, thank you for joining us in Zurich and sharing your insight. Without you, this would not have been possible. Thank you so much for that.
Thank you.
Dear guests at home or in the office, I hope you enjoyed today's conversation about our digital health study. By the way, you'll find the study as well as a link to a recording of this event in your inbox in the coming days. In the same email, you will also find a feedback link. We'd really appreciate if you could use this link and help us make our events even more relevant and inspiring. In that light, I would like to thank you for joining us today. We hope to stay in touch and wish you a great evening. Goodbye.